Hey, this is Mark Garrett over here at National Senior Savings. I'm also your host on the Medicare Minute. That's our podcast that you can find on iTunes or Google Play Music just by going there and typing in the Medicare Minute. This is another Medicare learning module. This is module number 4. When can I enroll in a Medicare Advantage plan? So, when can you enroll? The first time, it's called the initial enrollment period. So that's when you first become eligible for Medicare. You get to sign up during this initial enrollment period. It's for Medicare that you've spent your whole life paying into it, looking forward to your retirement years where you get to enjoy it. So you can sign up for Medicare 3 months before, 3 months after, or the birth month of when you're turning 65. So what that means is you have a 7-month window to sign up for Medicare when you are turning 65. The same applies for people that are on Social Security disability income, except it really doesn't matter the age. You just have to be on Social Security disability income, not SSI, for 24 months. And once you're on that, you can sign up the month of your anniversary for 24 months, or you can sign up 3 months before or 3 months after for your Medicare. If you have Part A coverage and you get a Part B for the first time during the initial enrollment period, you can also join a Medicare Advantage plan or sign up for a Medicare supplement, Medigap, with a Part D prescription drug plan. So between October 15th and December 7th, anyone with Medicare can join, switch, or drop a Medicare Advantage plan. Your coverage will begin on January the 1st as long as the plan gets your request by December the 7th. So that's not your initial enrollment period, and we're going to talk more about the annual enrollment period in just a second. So you also have what's called a general enrollment period with Medicare, and that's for people that may have forgotten for whatever reason to sign up during their designated 7 months. They actually can get Medicare fully, Part A and Part B, by signing up between January the 1st and March 31st of the following calendar year when they were scheduled to sign up. The effective date when you sign up during the general enrollment period will be July the 1st of that same calendar year. So after the initial enrollment period and the general enrollment period, you have what's called the annual enrollment period, and I mentioned that a moment ago. It happens every year. Every single person in America, 57 million people that are on Medicare, between October 15th and December the 7th, they can join a Medicare plan, they can switch, they can drop a Medicare Advantage plan. Your coverage will begin on January the 1st as long as the plan gets your request by December the 7th. So real important, you can't sign up before October 15th, you cannot sign up after December the 7th. Any changes that you might want to make during that annual enrollment period need to be done between those two dates. And like I said, you can join a new Medicare Advantage, you can drop Medicare Advantage and go back to original Medicare with a Medicare supplement, or you can go back to original Medicare with just a prescription drug plan. It's really your choice. All right, so the next important period that you need to remember is the disenrollment period. And basically, can you make changes to your coverage after December the 7th? And the answer in short is yes. Between January the 1st and February the 14th, that's the day Cupid comes to your house to see you. So please don't forget to buy your wife those chocolates and those flowers. If you're a Medicare Advantage plan, you can leave that plan and switch to Original Medicare. If you switch to Original Medicare during this period, you will have until February the 14th to also join a Medicare prescription drug plan to add drug coverage. So what can't you do? You can't switch from Original Medicare to a Medicare Advantage during that period. You can only do that during your annual enrollment period. You can't switch from one Medicare Advantage plan to another. You can't switch from one Medicare prescription drug plan to another. You can't join, switch, or drop a Medicare medical savings account plan during the disenrollment period. So real important to know, it's very simple. You don't even have to notify the company that you're dropping the Medicare Advantage plan with, because you're going to be required to have a Part D prescription drug plan when you sign up for it. Between January the 1st and February the 14th, it automatically disenrolls you from that Medicare Advantage plan you're on. Real important, if you do get off a Medicare Advantage during the disenrollment period and you get a prescription drug plan and go back to original Medicare, you may also sign up for a Medicare supplement. There's no blockage on the enrollment period for a Medicare supplement if you have original Medicare with a prescription drug plan. So the special enrollment period applies in very specific circumstances. Most people aren't going to run into a special enrollment period, but they do exist, and they exist for a good reason because there are people that run into situations in their life that they may need to have another enrollment period to get the benefits they need. So let's say you moved out of your service area, you were in North Carolina, you moved to Arizona. When you left North Carolina, moved to Arizona, your plan was not available to you in Arizona, the Medicare Advantage that you had in North Carolina, you will be given an opportunity to sign up for a new plan during this period of time. If you have Medicaid to go along with your Medicare, you're considered dual eligible, and people on Medicare and Medicaid actually can enroll in a new plan every single month of the year. They could change their plan if they wanted to. I don't ever suggest that, but they have the ability to do that. So if you qualify for extra help, so some people when they make a application to the federal government and their state government, they get extra help called low income subsidy on their medications. And I have a video that talks specifically about that on my site. So if you get that extra help, you also can change plans every month, no matter what month it is, to any Part D prescription drug plan or Medicare Advantage plan you want to. If you live in an institution like a nursing home, there are special circumstances for that. And if you leave a company or a pension group coverage past 65. So let's say you're 68, you worked up until the time you're 68, and then you decided to retire fully and you were no longer going to get your benefits, your health insurance from that company, you would have an opportunity created for you that is a special enrollment period where you could fully enroll in Medicare Part A and Part B and a prescription drug plan, Medicare Advantage plan, or a Medicare supplement plan at that time. So, with that being said, there's one other special time that you can actually enroll in a different plan. So, this applies only to Medicare Advantage plans. So, if you're on a Medicare Advantage plan and it's not a 5-star plan, which is the highest rating that you can get, and I will let you know very few companies ever achieve a 5-star rating, you will actually have an opportunity between December the 8th of that year and November the 30th of the next year to enroll in that 5-star plan, because what the government's saying is that this plan has succeeded so well and met all the requirements that were asked of them that they are going to allow you to join up what they consider to be the best plan in your area. So you always have that opportunity. Keep your eyes open. You can find it on Medicare.gov by searching plans. You can talk to a local independent broker in your area. Most anybody that's in the business can answer the question for you, are there any 5-star plans out there? So how do you switch plans? Well, follow these steps if you're already in a Medicare Advantage plan and want to switch. To switch to a new Medicare Advantage plan, simply join the plan you choose during one of the enrollment periods. You'll be disenrolled automatically from your old plan when your new plan coverage begins. So as we learned, that's either with an SEP or the AEP. You can't just do it any month of the year. If you're on Medicaid or low income subsidy, you also have every month of the year that you can change plans. So to switch to original Medicare, if you just want to go back to original Medicare with nothing to go with it, contact your current plan or call 1-800-MEDICARE and they can help you out. Now, you may also want to consider joining a Medicare supplement insurance Medigap policy if you're eligible, which means that if you're past 65 years of age, it's going to be medically underwritten. You may or may not qualify to get a Medicare supplement at that time. The most important thing, though, is you really don't have to call Medicare, because if you want to go back from a Medicare Advantage plan just to original Medicare, all you have to do is simply join a prescription drug plan, Part D, and that will automatically disenroll you from whatever plan that you are on. So, in summary, there's a multitude of times to enroll or switch your Medicare Advantage plan and your prescription drug plan. If you're not sure, contact a broker to ask about your options. You can also contact Medicare at 800-MEDICARE. That's 800-633-4227. And keep your options open, because there are so many good plans out there There are good Medicare Advantage plans that serve people in big cities well. There are great Medicare supplement plans out there. Really important to know when your enrollment times are going to be. I thank you once again for joining us today. Once again, my name is Mark Garrett, co-owner at National Senior Savings, host of your podcast at the Medicare Minute. You can find us over at iTunes or at Google Play Music by typing in the Medicare Minute. Go to our site, nationalseniorsavings.com. You can always reach us by calling 800-708-5810. Thanks and have a blessed day.